Ethics of care challenges traditional moral frameworks by focusing on the significance of relationships, empathy, and interconnectedness in ethical decision-making. The main key principles for ethics of care are empathy, responsiveness, and alternativeness. This ethical theory was developed as a response to the shortcomings of traditional ethical theories that prioritize consequences and concentrate on personal dimensions of human experience. It differs from other ethical theories from its prioritization of responding to the specific needs of individuals within those relationships instead of universal rules. One objection to this theory is its potential risk of reinforcing traditional gender roles and its applicability in addressing broader social issues. We can use feminine and masculine virtues as an example. Compassion and nurturing are good qualities for women to have and should be encouraged, but modesty and fidelity should not be something women are required to have and to be reprimanded, mistreated, or ridiculed for not having them. As for men, it's good for them to not place the blame on others when they are to blame, but they shouldn't be forced to suppress or belittle their emotions. Another objection to this theory is questioning cultural diversity and whether the principles of care can be universally applied across different cultural contexts. This concern addresses how relationships that come from cultural diversity can change depending on the culture. In sum, applying ethics of care could be seen as an intrusive or inappropriate. Its biggest dilemma is how its principles might not be universally applicable without considering cultural norms. From a wider perspective, ethics of care is a bit similar to intersectional feminism. Intersectional feminism is a framework that recognizes and addresses intersecting social categories and systems of oppression that people may experience. This compares to ethics of care by both of them being feminist frameworks, where one focuses on relationships while the other focuses on social identities. The three problems that intersectional feminism aims to solve are racism, sexism, classism, and homophobia. Everyone has multiple different identities that make them the person they are, and these identities can cause everyone to have a different experience in their life. People can be faced with different forms of oppression depending on their gender or race or sexual identity makes different from everyone. Intersectional feminism recognizes this and strives for inclusivity and accompanying to all aspects of people. However, this, of course, is not without its concerns. Its biggest concern is how intersectionally it is in complexity. Analyzing all the intersections of multiple identities can lead to some inaccuracies, and put those principles into action can be challenging. All these different components and are so complex would make it difficult to establish universally acceptable solutions that everyone can follow.